I think there are lots of things we can do to improve the transition of care. The development of standard approaches to the way that we handle care transitions are a beginning. It's important within those standardization strategies that we individualize for those factors which are patient dependent and family dependent, such as their level of sophistication and ability to communicate. I think that the use of protocols for things such as medication reconciliation and teaching are useful in that process. Most importantly, our communication efforts. The communication efforts that are most effective are personal, straightforward, collaborative encounters with the patients and their families, helping them understand what the medications do, what the strategies are, and what to expect are imperative in that care transition. Using electronic medical records so that all providers have access to the information that has been generated over the course of the illness are also very useful. I think that collaborative efforts involving the providers themselves are also very important. Today, in the transitions of care that take place, patients move from perhaps the interventional cardiologist's care back to the general cardiologist's care, then to the primary care physician, and they are having encounters with pharmacists and dietitians and physical therapists, all of whom must be communicating, all of whom must be sharing the patient's information and communicating the same information to help those patients in their care transition. It's also extremely important, I think, that the patients be able to communicate with each of those providers so that all involved in the care team understand the encounters that have taken place, the communication that has occurred. Patients, as we know, will often communicate different things to different members of the care team. Patients are often afraid to ask their cardiologist a specific question, but will oftentimes ask their nursing staff, caregivers, or their physical therapy caregivers questions they would never ask us. We must understand that. I think there are lots of programs to help us in transitioning care. The American College of Cardiology Hospital to Home program is an excellent example of a quality improvement initiative to assist in this type of care transition process. The goal of that program is to simply reduce the 30-day all-cause readmission for patients who've been discharged from the hospital with congestive heart failure symptoms. There are still, I think, lots of areas of improvement. Rather than improving the transition itself, oftentimes the goals of those improvement programs are sort of to impose particular strategies. I think that the H2H program, for instance, provides a central strategy, a central theme of information and tools and other techniques to help, but it can be used and personalized and built upon to develop a care transition strategy in your particular healthcare environment, which is effective for you and for the patients. The H2H program focuses on really 3 evidence-based areas for improvement. The first of these is early follow-up. We know that patients who have early follow-up within the first 7 days of discharge have a significantly improved level of comfort and ability to remain out of hospital because they have a contact. They understand that they are receiving ongoing care. The second is the management of discharge medications. It's very clear that our single most fragile point in the transition of care is in the medication adherence arena. Patients are transitioning from one level of care where they have been administered medications to a situation in which they are responsible for those medications. Oftentimes, they do not look the same. The physical product that they are taking appears different, and it is frightening to them. Oftentimes, they don't understand what those are for, and so it's our responsibility to help in that transition. The third is the straightforward and sometimes obvious but not considered teaching the patients and their families what signs and symptoms are going to occur. It's very important for the patients and their families to be comfortable that what is occurring is normal as part of their illness, and specifically those things that are not normal, those things that should raise alarm, those things which should bring them back to their provider's attention quickly. The care transition interventions that have been popularized by Dr. Eric Coleman are an excellent example of ways in which we can facilitate patients and providers by giving them tools and skills which help in the care transition. Dr. Coleman's 4 pillars are very simple. Adherence to medication self-management. That assistance so that the patients and their families can manage their medication strategies is imperative. A patient-centered medical record, which is owned and maintained by the patient to facilitate cross-site information transfer, is also intuitively helpful. Timely follow-up with either the primary physician or their specialty care providers also helps in reducing readmission. And finally, a list of those red flags which indicate a worsening of the condition and providing instructions specifically how to respond to them are very useful. This has been evaluated in randomized controlled trials and lowers readmission with this type of intervention relative to simply allowing the patients to their own devices.